Okay, welcome to Asymmetry 101. Can you guys all hear and see me okay? Good. Let me just get a quick
Yes.
idea. Thank you. Let me get a quick idea of who I have here. Can you guys raise your hand? Zoom has like a raise hand function. If you are just a regular person, you don't have any affiliation with the fitness industry, you are just the average person trying to help yourself out, maybe a family member, maybe a friend. Okay. Yep, yep, yep. That's a good bit of us. We're up to, okay, creeping up towards 100. All right, that's good to know. Now, if you wouldn't mind putting your hand down, if that's a thing, uh, now let me know if you are a personal trainer or a strength coach. Let's just kind of put those in the same category. Let me see how many of us we got here.
Maybe. I don't know.
Okay, keep the hands coming. This is just going to help me understand how I can tailor my language, how I can tailor this best to you guys. All right. Now, what about like a physical therapist or athletic trainer or someone like that? Put your hands up. Oh, quite a few. Okay. That's cool. I like that. That's good to see. Okay, thank you guys for letting me know that. I just wanted to get an idea of what we got going on here, what our population is here. So that's fun. That's exciting. Okay, let me just really quick before I get started, just I request that you guys stay muted, please. Nothing is more disruptive than just like hearing like someone unmute themselves on accident, like their baby's crying or whatever. So please, just out of respect for everyone here and the flow of the presentation, let's try to keep it as quiet as possible outside of my voice. And I will have time at the end of this for a few questions. This is a different variation of a webinar that I've done before. So I don't necessarily, whoops, I don't know what I just did right there. I don't necessarily, whoa, what am I doing here? Let me get out of here. There we go. I don't necessarily know how long it's going to take me 100% accurately, but I think it should take around an hour, plus or minus some time. But without further ado, let's get into it because I want this to be fairly interactive. There's going to be some hand raising. The chat function is going to be used. So if I do ask a question, please just put it in the chat rather than saying it out loud. And that way we can get some different ideas flowing of when I actually do have a question for you guys. So I'm excited. I think a lot of us probably have followed me off of Instagram, YouTube, something like that. And a lot of what I'm commonly known for is asymmetry and working with imbalance patterns, posture, movement, etc., and trying to resolve those things, resolve those problems. And I want to kind of like clarify some of the myths around asymmetry, some of the things that may be potentially not helpful, and some of the things that actually are helpful. And then what we can get into in terms of assessing these patterns, these postures, and what we can do to actually resolve them and fix them and give you some tools that actually are helpful immediately. So here, real quick, I think there's a way that I can do something. Let's see this. All right, cool. Let's get started. Let this boot up really quick. Full screen. Okay. So once again, welcome. Thank you guys for taking time out of your day. I really genuinely appreciate it. Every time I do one of these webinars and I see like, several hundreds of people here live, it's always like, honestly, it's a little nerve-wracking. There's a lot of people here, and it's humbling to see that you guys would take the time out of your busy schedules to be here and listen to me talk for a little bit. But, I've before I was doing these webinars, I used to attend webinars like this all the time. And something that I would always get frustrated by is the lack of like, genuine, like tangible value that I could extract from that webinar. And that's not my goal for you today is to walk away feeling that. I want you to walk away from this feeling like this was very much worth your time, that you have a very confident idea of what you can do to start to play around with some of the stuff in this webinar to get really nice immediate outcomes, whether that's with yourself, with your clients, with your patients, whatever. I've tailored this so that way anyone can watch this and get a pretty good idea. Now, obviously, a physical therapist or a personal trainer is probably going to have a little bit easier of a time understanding some of the stuff that I'm talking about here. But that does not mean that if you're just the average person, which there are several hundred of you in here, that is just trying to help themselves, you should be able to watch this and have a pretty good idea of what to do. And that's kind of how I tailored this because at the end of the day, like a lot of you guys that understand my content and a lot of you guys that have been following me for some time, generally, like I know my audience pretty well. Like you guys are sharp. You understand a lot of the stuff that I'm talking about. You kind of like get basic anatomy to a certain extent. You understand like very basic muscle function. So with that sort of like understanding, we can move forward and we can kind of get into some advanced stuff, but not make it too crazy and overcomplicated for you. So kind of what we're going to do today first is define what it means to be asymmetrical. We're going to appreciate natural human asymmetry because this is Asymmetry 101. So we're going to talk about what is the most common asymmetrical pattern. And then we're going to learn simple assessments that help us understand posture and limitations. Now, I do want to say that there are 6 assessments and they're all kind of self-guided. But if you are a personal trainer, if you are a strength coach potentially, if you're a physical therapist, then you will have a passive playlist that I will send you a passive playlist meaning like you perform the assessments on someone else. That's going to be there for you. So that way, like you don't have to just do these assessments actively with everyone. Technically speaking, I actually do prefer to do these assessments passively, meaning I am performing them on someone else. But if you're, again, the average person, then you don't have that opportunity. So you need to learn how to do these assessments genuinely on yourself and know how to properly execute them with just obviously yourself in the room and no one watching you. So that's the baseline, and that's what I'm going to show you today. Okay. Oh, finally, obviously, number 4, we're going to see exercises that address these asymmetrical patterns. We're going to talk about some strategies of what is the difference between the exercises you're going to see here versus, I don't know, stuff that you would typically see on social media. And I think it's going to be really insightful for you. Okay, the question is how do you get changes like this? How do you get long-term changes in posture? And to be completely honest with you guys, you might be surprised to hear that I actually don't really care about posture all that much. In the sense of posture is telling me something that I think is, I see some people are like, I don't know how they got the function of like annotating on the screen. If we could not draw on the screen, that would be awesome if you guys don't mind. I actually don't really care about posture. And the reason why I don't, in the traditional sense of like, I want to see a tangible postural improvement like this, yeah, that's cool. But at the end of the day, what really matters to me is how someone moves and how someone feels. And I have seen a decent correlation between posture improving and how someone moves and feels also improving, but that's not always a one-to-one thing. What's really cool about posture, though, is it tells us a story about the individual. And that story is very valuable. We'll get into it in a second. But in order to actually get changes that are meaningful, and if just trying to improve your visual posture is your thing, like you just want to, feel more confident in your own body and how it looks, that's cool. Like I have no problem with that. But I just encourage you not to overly fixate on it because it's easy to do that. What really matters is how does your body feel on a day-to-day basis? And again, there is, in my experience, a decent correlation between posture and how someone feels, but not necessarily always. And we'll get into that more. But if you do want to get nice changes, the first thing you have to appreciate is that these asymmetries are patterns. They're not isolated problems. So you look at this gentleman on his left before picture, you might say, well, it looks like his shoulders are the most tilted. So doesn't that mean that his shoulders are probably the biggest problem? No, it does not. It is a reflection of someone's strategy to handle how their body weight is being distributed, and their shoulders just happen to be the more tilted thing. But this is representative of what's going on with this whole gentleman's center of gravity, his whole body's pattern. And I can tell you, because I worked with this guy, that actually his shoulders weren't the biggest problem. It was actually a combination of his feet and his pelvis, and his shoulders were just along for the ride. And I can get into the complexities of it, but that's really what it came down to at the end of the day. So if the shoulders are tilted in a certain direction, then the head is going to obviously have to compensate for that. The hips, or if the hips are tilted in a certain direction, the shoulders are going to compensate via tilt. These are just global things, but they're happening because the entire body is trying to do something, or it's stuck in one particular pattern and it's not able to do other things. That's what this is telling me. Okay. So it's not like I need to look at this person and say, oh, looks like I need to bring your shoulder down on the right a little bit. I need to bring your hip down on the right a little. And it's like, no, that is looking at the symptoms, not the actual root cause. These are really rotational problems. What this is telling me, and you'll see the correlation, is if this guy has a higher hip on the right side, it's likely that he's kind of unable to push out of his right side. He's probably turned to the right side to a certain extent. Does that make sense? So, what we really want to do is appreciate what are the movement restrictions here and what do we need to do to improve those at their root source, what the root cause genuinely is. Does that make sense? And if you
Okay, I
do that,
was
what you'll find is that you'll actually improve their posture along the way if you're addressing what the genuine movement limitations are. Okay. And like I kind of mentioned, I hinted at this, but didn't go into a ton of detail. It really is, at the end of the day, all about managing center of gravity. Now, I'm showing you not necessarily asymmetries here. This was 3 days of working with this person. So, like, she flew in to my gym where I am right now in San Diego, California. And then 3 days later, this was her, like, after. Once she was coming in cold, I always take someone's posture cold, so that way, like, it's a representation of like genuinely how much they've changed. This person is leaning forward. Their center of gravity is forward. The orange line is like what would normally be upright, and the blue line is representative of like where she actually is. So within 3 days, we helped significantly improve her center of gravity. And it's not necessarily like, you look at her low back and like there's not a ton of necessarily like anterior pelvic tilt or like a ton of forward head posture. Really, her whole body is just tilted forward. It's just pitched forward. And that's because her body is trying to achieve something. It's trying to alter the center of gravity because it is unable to move forward in space with genuine motions. So it's kind of just pitching the whole body forward to help it out and move via compensation. So this is helpful information. Their center of gravity is forward because of some probable movement restrictions that we can talk more about later. But in order for me to actually improve, like let's say her forward shoulders, like she had more so on the before, I need to help shift everything back because that will naturally help everything out. I think you guys can see me pretty big right now, right? Like I'm like relatively large on the screen. Can I get a thumbs up? Yeah. Okay. If I'm pitched forward like this, you see what happens to my shoulders. But if I lean back, all of a sudden things look better. And that's kind of what we're trying to hint at here is it's not this isolated problem at the shoulders or like the head or the hips. It's a whole body strategy, which is pitched forward. And you notice that if you bring the hips back, the shoulders come back, the head comes back. It's all good stuff. So let's have a little discussion in the chat. Again, don't unmute yourself. Just like give me some chat responses. Why do you think asymmetries matter? Why do you think it's important to resolve imbalances that are significant? Why do you think? Less pain connects the whole body, wear and tear on the body. I like that. Imbalances lead to compensatory patterns. Yes, less wear on joints. Okay, we're getting there. It costs extra energy. This is actually all very accurate. I like this. Yes, energy leaks can only get worse. That's actually, yeah. So check, you guys are on the money. I like a lot of what you said here. So asymmetries matter to a certain extent. Now, the research is actually pretty inconclusive about the significance of injuries and how much pain is present. What you will actually find is that posture is not necessarily correlated with pain in the research. And I think that this is for good reason. How many times have you seen someone that looks
Right.
extremely asymmetrical, or you just look at them and you're like, boy, you look like you're in a ton of pain. But when you talk to that person, they're actually not in that much pain. Or you see someone who's just ever so slightly tilted, like this guy right here, and they're in crippling chronic pain. It happens all the time. And that's because it's not just posture equals pain in a vacuum. Really, what it comes down to is what is your posture telling us about your movement capabilities and your ability to manage gravity? And how does that influence how much movement you have, how much genuine movement you have? And then you have to consider, well, what are you doing in your life that requires X amount of genuine movement capabilities? Maybe if you're just sedentary all the time and you have horrible posture, you're not actually going to be in that much pain because you don't actually do stuff that like demands much of your body. Or maybe you're just a little tilted, but you're tilted in the wrong way, but you do something that really requires you to do something that tilt inhibits you from doing. So you actually create really large compensations despite visually not that significant of a tilt. And so that really matters for you in particular because of your lifestyle, your job, your athletics, whatever. And I think that that's what a lot of people miss when it comes to trying to address these imbalances or trying to consider these imbalances. It's not that posture equals pain. It's what is posture telling us? What is it telling us about your movement strategies? What are your movement strategies limited in? And how does that relate to what you need to do in your life? That's really what it comes down to. Okay. So if we want to fix asymmetries, there's five what I would call non-negotiables. The first is that they're normal. Everyone, literally everyone has them. If you are a human being that walks the planet Earth, you are asymmetrical. It is literally impossible. And I use that word. I know literally is like this word that people use, they over exaggerate, but I mean it at the truest essence of that word. You are asymmetrical, and there's nothing you can do to permanently fix that because you have a heart on the left side of your body. You have a diaphragm that's larger on the right side of the body. You have a liver that's on the right side of the body. You have asymmetrical lungs. So, of course, this is going to affect you for the rest of your life and eternity. You're just born that way. But they're problematic if they're unmanaged, uncontained, or significant to the point of which it's limiting you from doing what you want to do with your life. Objectivity. We need to have efficient assessments that tell us and really provide us objective data, which we can then act on to help us guide our programming. It is a huge mistake to look at someone's visual posture and only go off of what that posture is telling us to fix their movement or assume that they have certain movement limitations. I've been surprised way too many times to just look at someone's posture and go, yep, I know what you need. You can see some really interesting things. And I'll talk about that in more detail later. My course in particular goes into some of the more nuanced, complex cases, but you need to appreciate posture in combination with more objective assessments like we're going to be talking about today. Finally, I think it's important that we need to address and be able to explain these things in a way that makes sense and is very simple. If you can't explain what you're seeing in a very simple way, I believe you probably don't understand it at the level that you need to. If you're trying to work with other people, if you're trying to fix yourself, it's a process that kind of it ebbs and flows over time, and like you'll get better at it, but you don't necessarily need this piece. But if you are a rehab practitioner or someone that works in the fitness industry, I very much believe that you need to be able to explain it to a third grader if you're going to explain it to the average person, because the average person, some people don't even know what their hamstrings are. Some people don't even know what flexion or extension is. So you got to be able to explain it in a very simple way. That's what I'm going to try and do today with you guys. And then finally, address the system, not isolated pieces. You have to consider that if you make a change at the feet, it's going to influence their shoulders and neck. If you make a change with their neck, it's probably going to influence their feet and everywhere else in between. So if you consider this total body thing, which is what I'm trying to get at over and over again, you'll have more success. Here's a case study. A guy named Jacob. He came to my gym a little while ago, and you can tell I did not. So when I was actually uploading this picture, I was like, huh, it looks almost as if like I just took a step to the left and took a picture of his back. And then like the next picture, I just like took it more square on. I didn't do that. This was actually how rotated he was from a square, straight on side profile view. He was literally that much turned to the left. And it's like, yeah, he had back pain. I could see why. I think we can all see why. He also had significant foot issues. Actually, his foot was more of an issue than his back. And I have a full case study of this on my YouTube channel that you can see on your own time. We don't have time to go into it all today, but he was dealing with chronic pain. He used to be pretty jacked. Like he used to be a pretty strong, fit guy. He lost a lot of muscle mass because of his chronic pain. And so he worked with a bunch of different rehab practitioners. And over the course of probably, what was it? Somewhere between 3 and 4 different organizations and or people, they just gave him very surface level symptom based exercises, stretching, strengthening exercises, all the typical PT stuff that you would see, if you went into a very generic physical therapist office or personal trainer's gym and just was like, this is my problem. It's that type of stuff. So he was kind of really considering quitting his fitness journey because anything that had to do with exercise was just creating a lot of pain and frustration in his life. However, he came here and by addressing his actual total body pattern, we got him to look like this on the right after just 1 week. So it was pretty incredible. And I say this to show you guys, I'm not just sitting here trying to like flex or brag or anything. I'm just saying this to show you that if you really address what really matters, you can get really nice results with people. And it is just so genuinely incredible to hear someone say that you've changed their life. Like that is the most valuable, just highest dopamine response personally that I can experience in my life is just seeing someone's life entirely change when you address the root cause and they can do what they want to do. Like that's just incredible. And I hope it's a feeling that many of us can get as well. So I encourage you to watch that case study on your own. If you want to learn more about this stuff and you want to get into more of the nuances, I'm going to give you a lot of value in this webinar. But my biomechanics course, actually, the next round of it starts in August. It's a live interactive course. You get to talk with me as much as you want. Someone's drawn on this. You get to interact with me as much as you want. There's practical application sessions. I'm going to get more into this at the end of the call, but I just want to put it in your head now that this is a really great opportunity because you're attending this webinar. I'm going to give you a very special offer. So just stay tuned for that at the end of this. But just know that if there's something in this webinar that piques your interest a little bit and you want to learn more about it, this is the place to go. In this course, there's a way much more. I'm scratching the surface in this webinar. This course has a nice, fully laid out 3-phase progression model, 500 exercises. That's a vast library, but it's broken down into very digestible chunks. There's plenty of in-depth case studies so you can see how this stuff is applied at a realistic level because models are one thing, but to actually apply this stuff in a real life setting is what I want you guys to be able to see over and over and over again. So what I do in the course is I literally take participants in the course and I work with them right then and there in front of everyone, whether it's in person. Sometimes people just come down to see me and I work with them right there, then and there live. Other times it's just like over Zoom. And it's a really, really great way to see how this stuff actually works. That's really what I want to do. I want to practice what I preach in front of you guys. So if you want to learn more about that, stay tuned to the end. Also, there will be an email in your inbox at the end of this. So let's get into some foundations. The way that I like to view this total body pattern is through the gait cycle. Very generally speaking, you can probably turn into one side better than the other. You can probably push out of one side better than the other. For some people, they can push out of their left more easily and shift into their right. That's honestly more commonly the case. Other people can more easily push out of their right and shift into their left. It just depends on so many different factors. But if you can appreciate it through this lens, the whole total body thing starts to make a lot more sense. So we're going to get into this quite a bit. We have to define a couple of key terms here first, though. I like to call stance exactly what you're seeing right here. Stance refers to the mid stance phase of the gait cycle, where you have one leg off of the ground, you're shifted totally over to one side. It's the right side in this example because the image is flipped. So, looking at me from this view, my left side in the picture is actually the right side of my body. The shoulder is down on that side, your head slightly side to the other side. So this is essentially referring to the main mechanics that happen when we are in mid stance phase of the gait cycle. So again, guys, if we could not annotate on the screen, that would be great. I don't know how I can disable that, but that's just like something I'm seeing. Lateralization refers to the compensation where stance is only achieved on one side or the center of gravity is being biased towards one side in a compensatory manner. So this is very easy and simple to understand if you consider the idea of like lateralization entails being shifted over to one side and being better at shifting over to that side, but it's because of a compensation. It's not because like your body loves being over on that side necessarily. It's just that your body has created a strategy to better, more effectively shift over to one side more than the other. Maybe because you just feel better and your body, generally speaking, feels safer shifting over to one side more than the other. Or it feels unsafe shifting into the side that it is unable to properly shift into. Does that make sense? So that's really important to consider. Lateralization is a compensation where you are shifted or can shift over to one side more than the other. You can be lateralized to the right or lateralized to the left. But the goal is to improve occupancy. Occupancy is the ability to properly achieve mid stance phase of gait on a given side and effectively shift out of that side. So, lateralization and occupancy are not the same thing. Occupancy is like, yeah, I can get into my right side, own my right side, get out of my right side, shift into my left side, own it, and then shift out of it. Lateralization is I can just basically turn into my right side via compensation, and I'm not very good at getting out of it. You see the difference there? That's what's key to understand. Lateralization is a compensation, but the goal is genuine mechanics of occupancy. So if you are right lateralized, if you are in a compensatory manner, better able to shift over to your right side and not as much your left, you want to improve left occupancy first. So when we shift into mid stance phase of the gait cycle, this is essentially what you're seeing. Your head is side bent to the opposite side of the leg that you're bearing weight on because you want to keep your eyes straight ahead. You don't want, if I'm over on, let's say, my left foot, I don't necessarily want my head to side bend left because now my visual field is completely disrupted. I want to side bend to the opposite side so that way I can keep my eyes perfectly straight ahead. The body really cares about that, guys. The lower shoulder is present on the same side of the stance leg. The spine and pelvis are facing that particular side. So if I'm on, again, let's say right foot, because that's the one in this example right here, my pelvis is turned to the right. My foot arch is actually higher on the right side, and I am in a lower shoulder position. So again, let me show you guys this really quick. It's essentially this. It's the point in the gait cycle where you're taking a step forward. This leg comes off the ground. You're right here. This foot is just ever so slightly forward of this. Do you see how this shoulder is lower? This hip would be turned and a little bit back relative to this hip. This is where we are in the gait cycle. So this position is what I want you to really think about when we think about occupancy. Occupancy is the ability to own that single leg stance phase of the gait cycle. So here's commonly what we see. Now, you remember I hinted on like a lot of people have a right lateralization bias. This is actually supported in some good research. Does anyone know why more people are shifted into a right stance position? Put it in the chat. I'm curious what you think. Why do you think the majority of humans have more of a right stance than left stance bias? I heard the diaphragm. That is true. Organs. People are more right-handed. That is true, but why are they right-handed? Why is the majority of the population right-handed? 85 to 90% of people. Why are they right-handed? The brain, lymphatic system. Yeah. Yep. So I saw a lot of the right answers. Let's get into them really quick. Your brain is heavily asymmetrical. Now, typically what happens if I'm going to initiate a movement with my right hand, my left cortex is initially involved with that. We have more cortical motor neurons on the left side of our brain relative to the right. So, technically speaking, we have better overall dexterity potential on our right hand than our left. So, if we're constantly, I don't know, let's say like we're writing, we're doing something with our right hand, we're probably going to turn to the right side a little bit. You know what I mean? Look at these different hemisphere sort of, I guess you would call them characteristics. On the left side of the brain, which controls the right side of the body, like this is to me a little bit more like reptilian in nature. On the right side, it's a little bit more of like what makes us human. That doesn't mean like either of those aren't present on the other side, but on the right side of the brain, this is more of like human stuff. On the left side of the brain, this is more like animalistic. And that's kind of what we're getting at. This right bias is not just a thing that's exclusive to humans. It's actually, you can go all the way down the deepest rabbit hole of the research and see how like certain species of birds protect their right eye just out of instinctive safety more than others. You can look at gorillas and apes and how they run and walk and how their pelvises are shaped. It's fascinating. This is not exclusive to humans. But basically what we're saying is that we have a higher chance to have better dexterity just naturally on the right side of our body. And then again, I saw some people say organ asymmetry. Absolutely true. We have more weight and organs packed on the right side of our body. Our liver is a heavy organ. That thing is multiple pounds and it is sitting almost exclusively on the right side of your body. You have your colon, you have your gallbladder, you have more lung weight. The gallbladder is lesser of a consideration for sure, but I'm just trying to show you the asymmetry between sides. More lung weight, the liver, the colon are the big ones here. So you literally, if I were to cut your body vertically, pour down the middle like this, and I were to put your right side of your body on a scale and the left side of your body on a scale, your right side would weigh a few pounds more. So gravitationally speaking, you're literally just pulled over to the right side. This is the other big one. Look at how much larger the right diaphragm is than the left. The right diaphragm is considerably bigger in everyone, unless you were born with like some crazy condition, which you're probably unfortunately not going to live that long anyway. Most people have this very much larger right lobe, which sits on top of the liver, by the way. Whereas the left one, like the left one doesn't have a lot of stuff in the way, whereas the right one has the liver that's very much in the way. So the right one actually is better positionally able to work in our breathing pattern than our left diaphragm. Also, the other thing I want you to consider is look at the attachments of the diaphragm onto the spine. Look at those thick, meaty attachments on the right spine. Look at that little spaghetti string on the left. That matters. So, just in terms of the diaphragm's role in stabilization of the spine, it is so much more significant on the right side than the left. And then here's like a literal image of a diaphragm. And if you don't believe we're naturally asymmetrical after seeing this picture, I don't know what would convince you, because this to me is very damning evidence that we are heavily asymmetrical. So what ends up happening is that we have this total body picture where gravitationally speaking, and rotationally speaking, we're shifted over to the right side like this. But then air from the right diaphragm can help expand the left chest wall more effectively. So do you see where I'm at right here? So we're pulled over right, but this is open on the left. And if the stuff about the left diaphragm text right there doesn't make a lot of sense to you, that's okay. It doesn't really matter. Just understand what I just said about how we're overall biased towards this shift to the right and our left chest wall is open. I think that is the reason why you see the research supporting that there's a normal right side bend and turn to the spine. So typically what we're going to see is, yes, I skipped a slide right here. You're going to see a higher right hip, a lower right shoulder, a head side bent left, a sternum and pelvis facing the right, and the weight on the outside of a right foot. Is this all that different than this? I would say it's almost the exact same thing, except technically speaking, in this position, the hip isn't higher on the right side. The left hip should actually be higher, but you should be turned to that side. And that's just because you have one leg on the ground in the gait picture, but here you have two legs on the ground. So it's going to alter the tilt of your pelvis a little bit, but the rotations are the exact same. So really what this is telling us is that you are stuck in a right mid stance position. So doesn't it make sense that this would affect our gait cycle? Because it is not that different. As it relates to the pelvis, what you're seeing is that the left pelvis is more tilted forward, the right pelvis is more tilted back. And the left one is more externally rotated, the right one is more internally rotated. So if I'm looking at this pelvis right here, you can see if I were to illustrate it, the left one is tilted forward, the right one is tilted back like that. You see how that would turn me to the right? So what this is external rotation of this pelvis, internal rotation of this pelvis. You're seeing a slight difference in the rotations of these bones, which are called the innominate bones. Left one is more forward, right one is more back. Left one external, right one internal rotation. And I say I'm very clear about in a right lateralized bilateral stance posture, meaning like both legs are fixated to the ground, obviously via the feet, and you're standing in like a symmetrical stance. The lower limb, I think this one's pretty obvious if you just consider the idea, and you can try this on yourself. If you just stand up and lean to the right, your right arch raises, your left foot arch drops. So you're going to see this all the time. If I'm standing just normally, watch my feet. Right arch is up, left arch is down. So this is representing internal rotation of the left tibia because internal rotation is associated with a lower foot arch. And on the right tibia, it's more externally rotated, relatively speaking, and that is resulting in a higher foot arch on the right. Because if I were to take this here foot and I were to, now this is technically speaking a right foot. So just imagine that, when we go to the left, it's going to be left. If I turn out this bone externally rotated, it raises my foot arch. If I turn the bone in, it lowers my foot arch. So on the left, it's turned in. On the right, it's turned out. And you'll see this. Here's something you're never going to unsee for the rest of your life. Go watch people walk on the street and notice how many of them have a more turned out right foot than their left. This is enough to convince you in of itself. If you go watch people walk, because this right tibia bone is turned out, their foot tends to rotate out with it. You see that? And so that will allow that person to walk more effectively through a compensation because of their lateralization pattern. And there's more specificity we can go into. Like, technically speaking, if your foot arch is high like this, what are you going to have a hard time doing? Lowering your foot arch. But if you turn your foot out, that's going to allow you to more easily find the inside of your foot arch and push off. That's going to be easier. Let me kick off my shoes really quick. It's going to be easier for you to find the inside edge of your foot arch if you do this rather than straight on like that. So that's why you see a lot of people with a turned out right foot. On the right side, typically you see musculature that holds us into right stance, musculature that pulls us over to the right side, like your inner thigh adductor muscles, your gluteus medius, your side abs, and your inner hamstrings. Doesn't it make sense that muscles like your inner thighs, obliques, hamstrings, which tilt your pelvis back, these things are pulling us into the right side? And on the left side, what you're typically seeing is musculature that is pushing you out of that side. So doesn't it make sense that muscles on the back side of the pelvis and your hip flexors on the front side are going to be working in this sort of like push-pull thing where it's pushing your left pelvis forward and pulling it forward at the same time? So essentially what you're seeing is that your hip flexors on the left are pulling you forward. Glute on the left is pushing you forward like that. So you're basically doing this. So your center of gravity is being pushed forward on the left side. So what? The right pelvis is better at grounding, feeling the ground, shifting into that side. So typically, if you see someone do like a squat or a deadlift with a barbell, you see more right hip shifts than left hip shifts. The left side is actually better at propulsion. I pulled my Instagram a couple of times over the last few years, and I asked them without any other context, which foot do you prefer jumping off of more, your left or your right? And every single time, it's 51% of people say their left foot and 49% of people say their right foot. I've done it 3 different times. Thousands of responses every single time, tens of thousands sometimes. It's 51 left, 49 right. Isn't that interesting? Because the left side is just traditionally better at propulsion and pushing off. The upper body position is kind of what I hinted at earlier. Now, again, you're in this bilateral stance, meaning both feet are underneath you. Your feet are, hip width apart, facing relatively straight ahead, whatever that means for you individually. You're going to see this. You're pulled off to the right side. You're turned to the right side. So the right shoulder sits lower. The left chest is more open like this. So typically what you're going to see is a right chest wall that is tight and compressed, a left chest wall that is open like this. But watch what I just did with my shoulder. If I open my shoulder like that, doesn't that push my left shoulder back? And if I pull my right shoulder forward, doesn't that sort of pull my scapula, my shoulder blade away from my spine on my right side? So essentially what you're seeing is that the back side of the body, I believe I have another image. Boom. Yep. The shoulder's higher on the left, the shoulder's back on the left, but more forward on the right. Can you envision how that would happen? Because the left chest and its ability to stay more open like this is pushing the shoulder blade back on that side. But because this is compressed and tight, it's pulling the shoulder down and forward. And that pushing back of the left scapula is resulting in that moving closer to the spine. And on the right, it's moving away. So wouldn't it make sense that if you want to improve the ability for us to improve shoulder health, for example, or shoulder mobility, we would want to address this first and then the musculature associated with it? You could do I don't know, let's say you want to strengthen your upper back muscles to pull the shoulder blade back on the right side, because that would fix the problem, right? If you can't expand the front right chest wall, if this is always compressed and pulling you down here, you will never be able to properly get this to come up and the shoulder to go back. So you want to improve this first and then think about the musculature after that. That's the true long-term fix for an issue like that. Because you breathe tens of thousands of times per day, around 20,000 times. If you think like 3 sets of 12 of upper back strengthening exercises is going to override 20,000 breaths? Probably not. So you can use this information to fix left lateralization problems too. So if you had an individual that was shifted over to the left side, you would just flip this information that you're about to see. And it's not that their organs are flipped and their brain wiring is flipped and all that stuff. Really, what it means is that people oftentimes start right lateralized, but over time with compensations like lifestyle, athletics, injury, occupation, they end up finding a strategy to move over to the left side. And this is not all that uncommon. It's really not. And I think that it's important to appreciate that I'm telling you the basics and the foundations of asymmetrical patterns, but you absolutely will see stuff like this all the time if you're not already like it yourself. But the good news is, unless you're a complicated case, you just do what I'm about to show you on the other side. So let's talk about assessments and how we can determine whether you are more right or left lateralized. The straight leg raise is a nice, simple assessment. And again, remember, I'm showing you self-assessments because that's what everyone can do. But if you're a physical therapist, strength coach, my course, and also I will give you a link to these particular assessments, have passive assessments where you can perform them on someone else. They tend to be a little bit more accurate. They tend to be a little bit more consistent and reliable. But for now, we're just going to do this because that's what everyone has access to, is their own body. So a straight leg raise, what you're assessing for is internal rotation of the hip. Because in order for you to straighten out your leg, you actually need to internally rotate. And then to lift your leg off of the ground, you need to maintain and actually move into more internal rotation. So ideally, you get to about 90-ish degrees. I'm getting to about 75 here. If I were to go up any more than that, my lower leg would lift off of the ground. My left leg would start to move, or my knee would want to bend. I'd move via compensation. Most people have a lot less range of motion than they actually think on this. If you're really genuinely measuring your range of motion, you'll notice that if you think you have a 90-degree straight leg raise, it's oftentimes like 50 or 60. So this is me doing it very genuinely, slowly, and properly. You just want to make sure that nothing is moving on that table besides your leg. Go slow, make sure that you can film yourself to get an idea. And for now, don't even worry about the degrees. Just worry about which side is better than the other side. Because in order to do this straight leg raise, you need to be able to move into internal rotation of your hip. If you are lateralized to a given side, shifted towards a given side, you are internally rotated on that side more than the other in all likelihood. Hip abduction is a representation of your ability to push out of a given side, how much external rotation space you have access to. Ideally, about 45 degrees is good here. So for me, I'm getting pretty much all the way there. I'm pretty close, if not all the way there. And what this is telling us is how much space do you have to turn away from a given side? The way I can make this make sense the most is this. This is how I explain it to my clients, by the way. If I am turned towards a given side, wouldn't it make sense that I can turn this leg in more, the side that I'm turned towards, and internally rotate? And on this side, I'd have more space for this. If I'm turned right, this is easier, but this is harder. Can you see that? That's what's really important to consider here. And when we're walking and when we are pushing out of a given side, that's kind of like what you're seeing here. Does that make sense? So it's really key that you put a pillow underneath your lowest rib cage to make sure when you're starting this assessment, you see how I'm pretty flat right here. I have like the most minor indentation, but I'm pretty flat on my top side here. That's key because what you do not want to see is you don't want to see the hip hike up or any side bending occur because that is a compensation. So here, let me see. Can you guys hear this?
Slightly firm, but comfortable. So what we're going to do is get this leg
You guys hear this?
slightly less than a 90-degree angle. Probably right about there is totally fine. And then you're just going to let your head drop as if you're taking a nap and supporting your head, just as you would as if you were sleeping. And then what you're going to do is start with this leg a little bit up, and you're going to pull your leg back, stopping the point of pulling it back where you feel like if you were to go back any further, you'd be tempted to start to flare your rib cage. Don't go back that far. Stop it at the point where you feel like that's your end range. So for me, that's probably right about here. Okay. Now, what you're going to do is take this hand and just let it relax here. You want to make sure your shoulders are stacked on top of each other. They're not rolling back or forwards. The last thing to do is to make sure your hip is facing square ahead. It's going to be very, very tempting for you during this assessment to want to roll your hips back like this. Do not let that happen. Square them up. Make sure your shoulders are square. This can just be resting here like so. And then what you're going to do is you're going to keep your foot nice and level to the floor. And you're going to raise up in a perfectly straight line, stopping at the point, whereas if you went any higher than this, you would want to crunch.
That's
like
what you
that,
want to avoid.
or this hip would be pulled closer to your rib cage.
It's really hard to do, honestly. I prefer passive assessments where you do it on someone else because not only does this have to do with the space you have, but when you're doing it on your own actively, you now have to have the strength to lift up your leg in this way, which that can compromise your genuine reflection of range of motion. So I just love passive assessments. I think they're more consistent. I think they make more sense, but this can still give you a good idea. And which side is easier is really what you care about here. Okay. Next one is pelvis rotation. And this one's pretty straightforward. All you're really doing here is just keeping your arms flat at shoulder height, and you're stopping the rotation of your knees together at the point where your knees will start to separate. Your feet will start to separate, or the opposite side shoulder is going to lift off of the ground. This is what I use all the time in my content. So what I really want you guys to appreciate here is that I am not going beyond the point where if I went any further, let's say this is probably my end range of motion right here. I'm getting to about 80 degrees. If I went any further than this, my left shoulder would start to lift off of the ground, and I don't want that. You can get a little movement there, but you don't want to go to the point where, let's see, you see that? My right shoulder lifting off of the ground as I go to the left. That's bad. That is a compensation at that point. You don't want to go in that deep of a range of motion. So what I want you guys to appreciate, again, I'm going to keep saying this, which side is better, not necessarily the degrees. And you'll be able to know if you film yourself from that angle that you initially saw. The feet and knees stay together. You might have like the top knee slide behind the bottom knee a little bit, but it shouldn't be overly significant. And again, which side is better? The upper body stuff is easier. I have no problem people doing this actively indefinitely because it's pretty easy to measure this stuff. This is internal rotation of the shoulder, and this is measuring how much space or tightness maybe is on the front side of your rib cage. The more tight the front side of your rib cage is, the less you can genuinely express internal rotation of the shoulder. So there's another reason that I'll explain in a second, but ideally you want to get to 90 degrees where your forearm is relatively flat on the ground. I'd say 70 is decent. So for me, let's see what I'm getting to right here just to give you guys an idea. I like to just be in this hook lying position. I'm probably getting to about, yeah, almost like probably 70 degrees, somewhere around there. You don't want to go to the point where your shoulder lifts off of the ground like this. Your back shoulder should not lift up. If it does, you're moving via a compensation. So just be very mindful of that because you want to measure genuine range of motion. You do not want to measure compensatory range of motion because compensatory range of motion is just you moving through your spine. It's just you rotating your entire body rather than moving through your shoulder. External rotation is another one, and this will make a lot of sense to you in just a second. So you're just going to keep your elbow down by your side, stopping at the point where you need to push maybe about a 2 or 3 out of 10. And notice how my elbow is staying by my side. I'm not letting it drift away necessarily. You're going to see like that natural like opening of the elbow joint. What you don't want to see is like that. You don't want to see the elbow moving away from the body. You want to keep it tight the entire time. And so 90 degrees again is ideal here. Now, how does this make sense to the average person? Well, consider that if I am lateralized to the right side, let's say I'm kind of turned in this direction like this, wouldn't it make sense that this is easier and this is easier? So the side that you are turned towards, internal rotation will be better on the opposite side. External rotation will be better on the same side. But now, which you can literally try this on yourself right now as I talk. Try to just get your shoulders level, dip your right shoulder down, and turn to the right like this. And then bring your left elbow up and internally rotate. Now bring your right elbow up and try to internally rotate. It's harder, right? Now bring your elbows down by your sides. Try to move into external rotation. It's easier on the right, right? Now flip it. Put your left shoulder down, turn to the left. Bring your right elbow up, drop. Bring your left elbow up, drop. You'll notice these things line up. Every time I explain to my clients that way, it makes sense. It's instantaneous. It's very clear what's going on. But to get a layer deeper, if you have too much tightness on the backside of your rib cage, squeeze your shoulder blades down and back really, really hard. Then try to externally rotate. You can't, right? It's really difficult. But if you relax your shoulders, loosen them up a little bit, don't pull them down back, move into external rotation again, you get a little bit more space. So shoulder hoard, this one's the hardest one. But again, you're just comparing side to side. You want to start with your shoulders perfectly stacked. And what you want to do is only move through your shoulder joint, not at all through your rib cage or chest. So notice how if I were to go back any further than this, if I were to draw a straight line down, which I actually think I can, I've never really used this before. Straight line down. My shoulders are still pretty much perfectly stacked on top of each other. Can you see that? That's what we want. We do not want to see the chest open up. We do not want to see any junk happening outside of just the shoulder joint moving. So you'll notice that if I go back any further via a compensation, I'm going to start to move my chest. Do you see how my shoulders are very slightly starting to get unstacked? Do that one more time. You see how the shoulders, now if I drew that line, let me pause it at the right point. Yep. Now, if I draw that line, because I've moved in the video, I'm explaining how I'm compensating. But now, if you draw the line, it's on more of like this tilted angle like this. That is me moving through my spine and not my genuine shoulder mobility. That's what we're trying to measure right here. So if I were to look at what my genuine range of motion is, I'm probably getting to about 50 degrees, which is good. If you can get to 45, good. If you're less than that, you're probably limited. But ultimately, what this is telling us is how much space you have on the backside of your rib cage to turn into. If I turn my trunk to the right, I should be able to have space to turn into on my right side. I literally need to push my ribs back on the right. So if I'm turned to the right, doesn't it make sense if I'm lateralized to the right and I'm walking around like this all the time? This is easier. This is harder. Can you see that? If I'm lateralized to the left, this is easier. This is harder. And that's all that this is telling us. So if we're going to interpret assessments here, if someone is perfectly in that traditional right lateralized pattern, they're going to look exactly like this. They're going to have better shoulder internal rotation on the left. Why? Because I'm turned to the right. Remember, this drops more easily on the left. If I'm turned to the right, this is harder. Shoulder external rotation is going to be better on the right because, again, if my elbow is down by my side and I do this, it's going to be easier on the right, harder on the left. Shoulder abduction will be better on the right because I'm turned to that side. That's the one we just looked at. Pelvis rotation will be better on the right because you can turn your pelvis in that direction more easily. Your hip abduction, meaning raising your leg, if I'm turned to the right, will be better on the right because you can do this easier and this is harder. And straight leg raise will be better on the right because you can internally rotate better on the side that you are turned towards. So this is a representation of that in your straight leg raise. Okay. So what if you have mixed results like this? Take a second to digest this. Is this person still right lateralized? Yes. Whichever side has the most amount of circles is probably the side that you are lateralized towards. So just as a very, very general introduction, just keep that in mind. If someone was left lateralized, then they could look like this. They have 4 out of 6 things indicating that they are over on the left. Most people will have some mixed assessment. 5 or 4 will tell them that they're more on one side or the other. What if you're 3 and 3 though? Well, now you want to consider that this is potentially more of a complicated-ish situation. But the ones that I would really put a lot of stock in, guys, if I'm being honest, is pelvis rotation and shoulder abduction. So if you're split 3 and 3 down the middle, and like you have exactly 3 assessments better on, it could be upper or lower body split, whatever. Go with what your pelvis rotation and shoulder abduction are generally pointing you towards. So like, let's say we moved hip abduction, which is better on the right, to better on the left. Then you'd have 3 and 3. But shoulder abduction and pelvis rotation are telling you that they're better on the left. So they're more likely to be left lateralized. All right. Here's a question. Put it in the chat. How many people do you think I measure are left lateralized versus right lateralized? How many people, if I were to measure 100 people, how many of them are going to be more left lateralized? I want you guys to put it in the chat. Give me your best guess. Let's see here. Let's see, 30%, 20%, 15%, 70, 30, 15, 15. Someone says 80%. That's aggressive. 20. Okay, so I'm seeing a lot of like 15 to 20%. I would say probably about 35 to 40%. Somewhere in there. So yeah, I think some people literally got that correct. 35 to 40% of people I measure are left lateralized. And they will benefit from doing the exercises you're about to see on the opposite side. Keep that in mind moving forward. Now let's talk about exercises. All right, let's have a little discussion really quick about this really basic exercise. Now, again, these are filmed for a right lateralization. If you were left lateralized, you would do this on the other side. You would lay on your right side. Literally, all I'm doing in this exercise is laying on my left side here, and then I'm pushing my left foot into the wall. That's quite literally all I'm doing. And I'm just breathing through it. As I get better at it, I can create that tunnel that bottom side pillow was creating for me just a little bit more actively now. And I'm pushing my left foot into the ground. Why would I do what even is this? Well, let's think about it. If you were, let's back up and let's zoom out into what a traditional approach would be to fix a lateralization, where someone is turned to the right side, they're like this. You might look at someone, a traditional personal trainer, physical therapist, look at this person and be like, huh, okay, well, we need to do just a bunch of rotational work that will help turn you left better. No. That is addressing the symptom, not the root cause. What this person is unable to do is they are unable to occupy the left side of their body. They don't feel safe on their left foot. They don't feel the ability to properly have the ground work with them on the left side. That occupancy mechanic is key. So what do we want to do? Because this person is literally leaning on their right side more than their left, we want to help teach them what it feels like to feel the ground underneath. Watch me. You want to take them from this to side bending left, feeling the ground genuinely underneath their left foot. So that way, when they're walking, they take a step forward, they can own this position right here. Grounding and the ability to sense the ground underneath you is a neurological, it's a brain phenomenon. It's also biomechanical to a certain extent, but learning how to genuinely sense the ground is extremely important. And we need to do that without engaging any crap, which is like your low back, your hip flexors, your neck. All of that needs to stay off. So, literally, all I do with my clients, and this is one of the first exercises I give a lot of people, is just be in this position, feel your foot really even pressure against the wall. And all I want you to do is breathe in through your nose and out through your mouth very gently. Even in through your nose, out through your nose is okay. So you're trying to just get this person to create a relationship between their left abs working and their left foot pressure going against the wall. That is literally it. And you'll see how this is actually a beneficial precursor to an exercise that happens later. If I want to get a little bit more right chest wall expansion, length through the right side, you can have the arm reach overhead like that. Can you see how this position right here would be a direct counter to someone that would be, let's say they're here. This is getting them left side, left foot, right expansion. And you can get a pretty nice posture change by just doing this. It's pretty great what you can do if you address the true underlying root cause. So this is a nice starting exercise, and you guys will have access to these videos. I will send them to you as in the wrap up. And this is a 10-minute long video for such a simple little position because I want you guys to understand all the things that can go wrong, because a lot of things can go wrong. But to make it very simple, I just want you to get into this position. Don't even worry about reaching your arm overhead. Just be here with a pillow underneath you to start. Feel your left foot pressure, maybe just a 1 or 2 out of 10. Keep your neck and low back relaxed. Breathe. That's all you got to do. Neck and low back are relaxed, foot pressure evenly going into the wall, 1 or 2 out of 10, and see how much pressure you can put into the wall without your neck or low back or hip flexors engaging. See what happens. You might be surprised at how weak you actually are in this position. The next one is a side lying adductor, meaning your inner thigh muscle pullback. So can you see now there's no pillow underneath the side because we're laying on the right side. Again, this is for a right lateralized person. Can you see that this is going to shift the left side back? And as you push down, you're going to be working on that internal rotation component. Because remember, if you're turned to the right and you are right lateralized, traditionally speaking, you're going to be turned away from the left side. You want to learn what it means to shift into internal rotation on your left side. So you're going to be in this 90-90 position, and all you're going to do is shift the top knee back very gently, so much more gently than you think you need to, and exhale and very gently push down. Can you guys appreciate that these exercises are not more, harder, faster, stronger? In order to change what your body is capable of doing and its movement patterns and the way that it bears weight in a bilateral stance and a posture, you want to be relaxed. We want parasympathetic rest and digest. We don't want sympathetic fight or flight because that's a threat. So literally try a 2 out of 10 on these drills. You'll notice, by the way, if you do that properly, all of a sudden you start feeling your muscles engage in a very, for lack of a better way to describe it without you knowing what it feels like, a very genuine way, they feel like they lock in into like the right position. They feel like they're actually doing their job, and it's no longer like this strength training exercise. It's now this, oh, I can see how I'm trying to create a relationship. Look at what's happening with my foot and my thigh. As I shift that knee back, I'm trying to create a relationship between me telling my foot on the wall, hey, when my left foot is flat, I want me to be able to turn my pelvis to the left and feel my adductors help turn me into that side genuinely. Because what we're training here is literally the stance of the gait cycle where the foot gets flat and we're turning into that side. We're training the neurological and biomechanical things associated with this right here. And can you also envision that my foot arch will be raising as I shift that left knee back? Can you see that? My foot arch, it's going to be subtle, but my left foot arch is actually going to raise as I shift that left foot back. And that is also specific to that phasic gait. Do you see how this is so much more meaningful than just doing a bunch of like adductor strengthening exercises? Do you see how this would be so much better than doing just a bunch of Copenhagen planks, which by the way, I would still give someone a good amount of Copenhagen planks, all that good stuff. Awesome. But we have to have this component. We have to create context between how we are going to move and the joint neurological things associated with that and the ground. That's what is so powerful about an exercise like this and what other things are not going to be addressing. And finally, what about the right side? Well, this is just the sideline grounding exercise, but now we're just adding a lower body component to it with the glute. So you already have the pressure going into the wall, but watch what I'm doing now. I'm pushing my knee forward against the resistance of the band. I'm pushing out. This is incredibly important and helpful because what are you telling your body? You're telling your body, hey, when my right foot is working to push me out of my right side, I want my glute to work to better turn me to the left side. I want my glute to work to be able to work with the inside edge of my foot arch to push me from right to left. And that is that neurological association that you're forming. So I literally will tell my clients, think about developing a relationship between your right glute working and your right foot arch. Create that association, but stay relaxed. It's a 2 out of 10. It's a 2 out of 10. I know that sounds crazy, but if you treat it like a 2 out of 10, your glute will burn like a 6 out of 10. So you see what I'm saying here? Less effort equals more results almost every single time with a thing like this. So all you're doing here is just the same exact sideline grounding exercise. You're still feeling your left foot press into the wall, but now you're sliding your right knee forward and up. And you're just staying relaxed. Neck and low back are completely disengaged. If you want to progress it, you can rest your arm overhead. And this can get some incredible changes really quick if you do it properly. You can assess someone the right way. You can have all the right ideas about their posture. But just to be completely honest with you guys and transparent, the downside of my methodology is that you have to do the exercises right. And if you don't, you will not see successful outcomes. But the positive thing is that if you do them right, you will get incredible changes that are very meaningful and they start to stick longer over time because you're actually training the things that matter. But that's why there's like some moving parts to this stuff. But really, at the end of the day, you can make it as complex or as simple as you want. With this, all you're doing is just getting in this 90-90 supported position, making sure your pelvis stays neutral, pushing your right knee forward and up. That's really all you're doing. If you can stay relaxed while doing that, congrats, you're doing it right. On this one, all you're really doing is shifting your left knee back and pushing it down, keeping your left foot flat on the wall, maintaining a neutral pelvis. All you're doing on this is laying on your left side, pushing your foot into the wall. That's really all it is. But if you do that, you're going to be addressing the true underlying root cause. And if you guys want to learn more about that, you want to learn more about how we can actually create these long-term meaningful changes, my biomechanics course that starts in August is the single best way that you can learn how to do that. So again, I wanted to provide value in this. You guys should be able to assess yourselves and do exercises that help you move and feel better and also probably improve your posture at the same time. But if you want more and you want to learn more of the nuances, how to deal with more complicated cases, how to integrate exercise with it, because that's a huge component, that's what we're going to be getting into. We're going to be demystifying a lot of the stuff around this type of a methodology. We're going to be talking about why traditional approaches don't work even more into more detail, like you see in this example slide right here. There's practical application sessions. There's review sessions. There's just so much content for you guys, which you will have indefinite access to, by the way. It does not expire. You've already seen this slide before, but there's so many things that are going to help you apply this at the highest level possible. And if you're a personal trainer, a strength coach, anyone in the rehab industry, this is a very, very valuable skill set that is only getting more and more popular. And not to say that to toot my own horn necessarily, but this is something that people recognize has value. And a lot of, I think we're up to 5,000 people over the last couple of years have taken this course. So it's getting out there. I'll hang out here for the next probably 15-ish minutes. So thank you guys for your time. I sincerely appreciate it. You're going to get a link to all the exercises. You're going to get a link to the assessments, both passive and active. And yeah, thank you guys. I really appreciate the support. It means more than you can imagine. So any questions on any of this content? Let's see here. Scoliosis. So yes, scoliosis and this goes hand in hand, but I will say that like legally speaking, I can't necessarily give exercises that fix a specific diagnosis. But what I can say is that people with scoliosis tend to have certain movement limitations, range of motion restrictions that do tend to get objectively better with a methodology like this. Thank you guys for all the supportive messages. That's really cool. I appreciate that. Okay, let's see. Can you talk about how this would translate to something like running? Obviously, these were all based on static posture. So, okay, here's the thing. How does this translate over to something like a more intense gait cycle? The running cycle is a representation of the gait cycle, by the way, just it happens faster. And there's a little bit more like muscular involvement. So, if I am right lateralized, what I expect to see just in someone's normal gait, like if they're like this, what I expect to see is that when someone is walking, when they shift into their right side, their shoulder is going to dip down a little bit more. Their hip is going to hike up on the right side more than it should. They're going to have more time spent on their right foot, and they're going to have a harder time accessing this propulsion out of that side. And they're going to spend less time on their left foot. They're probably not going to see as much rotation to the left side. Also, what you're going to see is a lack of arm swing. So when you see someone walking and they're pushing out of their right side, what do? Their arm comes forward on the right, back on the left. So people that are right lateralized tend to have a very limited right forward arm swing for these reasons. Something, again, we get into within the course. So something that's very helpful is to do an exercise like what you saw today and immediately watch them walk again. And you can see that there's a pretty good instantaneous carryover. Now, gait changes tend to be more subtle than like your clear, like, oh, your pelvis rotation is like 30 degrees better to the left now after doing that glute max thing on the right. That's like a clear cut thing. Gait stuff requires a little bit more of a keen eye. But as for running in particular, you would expect to see a lot of those same things. It just happens a lot faster. So if someone's right lateralized and they're running, typically what you're going to see is like their trunk rotates to the right a little bit better. They tend to have a little bit more limited right arm swing, and when they're just jogging necessarily, you're not going to see a ton of arm swing. You probably shouldn't have a bunch, but it should still be present. You're usually going to see them, especially in their feet, is where it really shows up because you're going to see them have a hard time accessing the inside edge of their right foot relative to the left. So you're going to see the left foot go down more, right foot stays up more, relatively speaking, between sides. Like if someone has collapsed feet on both sides, you're going to see them, relatively speaking, collapse more on their left. All right. Well, what else we got here? Um, can the course help with sciatica? Yes, absolutely. Most definitely. My original injury, the reason why I got into this is because I had a slip disc, crazy left low back pain, crazy sciatica, and this fixed me essentially in a couple of days. Okay, here's an interesting thing. I don't want to get too much into the head and neck stuff, but I just saw a question about the jaw and how would an asymmetrical jaw influence this? There's actual literal research. I have a YouTube video on this. There's literal research that suggests that an asymmetrical jaw is associated with asymmetries in someone's gait, within someone's weight distribution, etc. And really what it comes down to is like very simply, if I am turned towards the right side, my jaw kind of gets left behind. And typically you see in a right lateralized pattern, someone has a jaw that's over to the left side. In a left lateralized pattern, you tend to see a jaw that's over to the right. And so some people, I would say about 5%, 10%, have a significant craniocervical jaw tongue issue that is holding them in their pattern. You can do all the right exercises, you can do all the right stuff with them, but this is the thing that's holding them in their pattern because of like trauma to this area. Their jaw didn't develop properly throughout adolescence. They weren't breastfed. They had some sort of like repeated head trauma, etc. You see that type of thing. And if that's the case, you need to work with someone that really knows what they're doing with like the airway, like craniocervical, biomechanics, etc. And that's beyond the scope of this presentation, probably. Craniosacral work could be helpful. Yes. Let's see. What else we got? Um, so here's an interesting thing. Someone said, like, I have a right labral tear, tight right hip flexor. Which lateralization does this fit into? I don't know. So here's the thing. Pain and posture aren't necessarily correlated. You can have a lower right shoulder that's more forward, but the front of your left shoulder hurts more. I see it all the time. So when someone tells me their subjective pain and when someone is telling me, like, Connor, my this hurts or this is tight, I don't know what to do. Which side am I shifted towards? I almost don't put a lot of stock in that. I almost don't pay attention to like that as a means to fix that issue. I listen to them because I want them to be heard and I want to like see what the thing we want to fix is, obviously. But as it relates to literally intervening, I'm not going to go off of that. I'm going to go off of what their biggest limitation is. Because, like we mentioned, it's a total body thing. So, if someone has shoulder pain, but their right foot is so incredibly locked up, and I can tell that that's affecting their gait and their overall lateralization, I'm going to go after that right foot. That doesn't mean that I'm not going to do something isolated at the shoulder because some people might think I'm crazy if I mostly do right foot stuff for a left shoulder. I'm going to give them something here to make them feel like they're being taken care of, and because there is probably some localized stuff to clear up. But what's really missing in a lot of programs is what is the total body pattern? Was the thing holding up the total body pattern? How about someone with hyperkyphosis? Okay, so we didn't get into a lot of like the overall body posture, meaning like, what if someone is really kyphotic on both sides of their body? What if they're just like really forward like this? Or what if they're like really forward in their pelvis like this on both sides? Let's talk about the pelvis one first. I've actually gotten better results fixing bilateral, meaning both sides of the body, like pelvis is forward on both sides, by doing unilateral exercises. I know that sounds crazy, but just bear with me. Bear with me. If I am really right lateralized, my right side is forward, my left side is forward, my right side is back. Yeah. But if I keep exaggerating this more and more and more, and I keep turning left or right more and more and more, then eventually I'm going to be forward on both sides. You can't only push the left pelvis forward. Eventually, the right side has to come forward with it. So, by addressing what really caused that initial issue, which for the overwhelming majority is one side started going really far forward, if you start bringing that left pelvis back, all of a sudden the right side starts coming back with it. Same thing with like really rounded forward shoulders. If the right side keeps going more and more down and forward because of right chest wall tightness, if you address that, all of a sudden both sides can start coming back a little bit. Can you see that? If I do this, then I open up that right chest wall, left shoulder comes back. So that's not to say that people don't benefit from doing something on both sides of their body at the same time, like opening up both chest walls somehow. You can definitely do that. But in my experience, the most effective interventions are ones that are asymmetrical in nature because an asymmetrical body requires an asymmetrical approach. How about sway back posture? Okay, sway back posture. Someone that is kind of like this. Well, I should probably show you on myself first. Sway back posture is kind of like this, right? So like their glutes are tight, tucked underneath them, and like you have a sway back like this. What's happening is kind of like a right lateralization person turning into a left lateralization person. Usually the center of gravity is so far forward on both sides. So they're being pushed forward that their glutes are like, stop going so far forward. Stop me from moving, literally falling on my face. If I go more forward, the body's like, I'm going to fall flat on my face. So the glutes compress the backside of the pelvis, but it ends up tucking them under them like that to prevent themselves from going too far forward. So what these people need is the ability to get length through the backside of the pelvis, the ability to open up that space. And then the rest, sorry, my phone is vibrating a lot. After you do that, you can then more effectively restore the overall center of gravity. Because what's happening with these people is that they have a center of gravity that's being compromised because of that lower compression of the glutes. And so and it's not like just do a bunch of glute strengthening, glute stretching or glute lengthening exercises. It's lengthen the glutes in the presence of shifting their center of gravity back at the same time. So an example exercise of that would be, let me actually share you one, because again, I like to provide value. This is one that we use in the course as well, and it's really effective for opening up the backside of the hips, driving some good, genuine internal rotation. So you see what we're doing here? Sliding the hips back, center of gravity is going back, opening up the hips, keeping a more neutral spine because these people do not have access to a neutral spine. You're breathing in that position. Every single time you take a breath, you go a little bit deeper into it, squeezing the ball a little bit. You're squeezing the ball, opens up the backside of the pelvis too. All right. I got time for one more, and then we got to bounce. I got to film some videos. Can we see these rotations because lower back rotation to the left if overall upper body is to the right? Okay, this is a very important thing. I touch on this more in the course, and I touch on this because this is a more complicated case. Sometimes you're going to see someone. Let me share my screen with you again really quick. And this is a huge concept, guys. We didn't have time to go into it really hard, but I do want to share it with you really quick. What if you had someone where their lower body was very clearly right lateralized, but your upper body measures like you're left lateralized, or vice versa? Let's say your lower body is very left lateralized, but your upper body looks right lateralized. Like, let's say you looked like this, like all three of the upper body ones were on the right, all three of the lower body ones were on the left, which that happens. So is it like your body is literally walking around like you're turned left here and no, you're not doing this. What's happening is that what's likely happening is that you are turned left at your lower body, but your upper body isn't as turned left as your lower body. So both things are turned left, but the upper body on this example is relatively turned to the right. So both things are left. It's just that this is less so. So this is turning out like it's right lateralized, but that's because when you're laying on a table, you're so far to the left, but this is to the right. This is going to be better. This is going to be worse. So you're going to present like that because of the way that you're laying on the table. So again, that's something that we go into more in detail, and some of you will present like that. But the key is that in that particular situation, you would still treat that person like they're left lateralized. You would still want them to do like a right sideline left glute max or a right sideline grounding. Cool, guys. I got to go. Thank you for your great questions. Thank you for your participation. I had a great time doing this. I hope it was engaging. I hope it was fun. Stay tuned for that email, which will have all of the resources coming your way. Thank you, guys, and I hope to see you at the next one.